Hi guys, it's been an awesome PLAB 2 course in Birmingham. We're just now en route to London for our immersion CSA course tomorrow. But I thought a really good video on verbal cues. We talked about this a lot today and how to approach cues that are flying out in the middle of a data gathering. Now, we don't normally miss cues. We don't miss them. We're doctors, we see patients for years. We do pick up things that we're supposed to pick up, but how you deal with a cue can differ across the board. So say, for example, you're doing a red flag history for someone with back pain, for example. You're in the middle of asking lots of medical questions, important medical questions, and in the middle of that, the word work pops out. Doctor, work's been tough, work's been a real challenge recently. Now, clearly that's a cue. Remember, we don't miss cues very often. Now, there's two different ways that people can deal with this. Number one, people will follow that cue straight away. Oh, you mentioned work. What do you do? Has it impacted it? Has your boss said anything? So before you know it, you're in this work discussion and you do understand everything you're supposed to understand about the work because of the cue, but you've left red flags behind now. So you're thinking, I'll come back to red flags later. Let me deal with work first. And the problem is you'll probably forget to come back to red flags. And before you know it, there's a big red flag question that's missed. It changes the whole game and it comes out later. Not because we weren't going to do our red flags, but because the cue took us somewhere else. So it distracted us and it took us away. So that's good because you do pick up the cue, but you can go zigzagging all over the case because every time you hear a cue, you follow it and time gets the better of you and you miss certain questions out. So some people will do the other extreme. So the word cue, the word work will come out, so the cue will come out, and we will just think to ourselves, work, that's important, it's a cue, I'll come back to that later, I've got to remember that. And you just carry on your red flag history because you don't want to go zigzagging everywhere and you're in the middle of red flags and you know you'll forget it if you leave it. And then later on, you'll come back to work. So what is it that you do for a job, Mr. X? Now, it's not always clear that you've come back to the work because of the cue a minute ago. Maybe a role player may think that, well, you're going to come on to work anyway there. It's nothing to do with the cue. The cue was missed 2 minutes ago. So we have done the hard work. We have picked the cue up, but it's not obvious because we've just left it. We've thought about it and we've come back later. So what we talk about a lot is the middle ground, really. We talk about reflecting verbal cues, reflecting them there and then, acknowledging them there and then. So it's obvious that you've picked it up, but you've not necessarily had to follow it. So say, for example, I'm doing that red flag history and it's quite an important history. I'm getting a lot of medical questions and that word work pops out. My job now is to reflect that back. Mr. X, you mentioned work. Clearly that's quite important. I'll come back to your work in a second. And then you go back and you finish your red flags. So clearly I have picked up the cue. There's no doubt that I've picked that cue. It doesn't have to be repeated 4 or 5 times because the role player may think that I've missed it. I've clearly got it, but I haven't allowed that to take me into a different zone and therefore potentially not come back and complete my red flag history. So try and get used to reflecting cues there and then. Don't just think that's important because when you think it, you're more likely to forget to come back anyway. But when you verbalize it, you're less likely to forget because you said it rather than think it. But also, because you're just reflecting it and not following it, your structure is better, your time management is better, and you're not going to miss some vital questions out. So try this when you're doing your role play practice. When it comes to verbal cues, remember, we don't miss them very often. We do hear things that we're supposed to hear, but by reflecting the cue there and then, you're much less likely to have other parts of your consultation affected, and you're much more likely to come back and re-pick it up when you're ready to do so, have it not look like you missed it in the first place. Hope this helps. Much more like this on our CSA, GP Stage 3 and PLAB 2 immersion courses, online training and audiobook courses. Hope this helps. #CampBassWillBass, #I went with Arora.